Hello everybody, my name is Drew Pizzullo. You may know me from the YouTube watch show It's About Time, but today I'm going to actually talk to you about something much more serious, which is a medical condition that millions of people face each year. It's that of how to treat an ear infection, most commonly an inner ear infection. I've had inner ear infections ever since I was a kid, as most people do. There's two theories of thought behind it. One is that you grow out of them. Others is that it stays with you the rest of your life. I don't know which one is true, as it all depends on your DNA, I guess. But there are different ways to treat it. I've gone to doctors, ear specialists. I've actually had my eardrum blown out twice, once through malpractice. And let me tell you, one thing you never want to do when you have an ear infection is go to a ear, nose, and throat specialist and have them blow out your eardrum. And when I say blow out your eardrum, that basically means when they want to put tubes in your ears to drain the fluid. That is the worst possible thing you can do for an ear infection. Because what happens is all the pressure that's inside your eardrum then shoots up into your head, and you can't pop your ears, which you can do by either yawning like this or by holding your nose and blowing out like you would do after you come out of the pool. Those are the two ways how to pop your ears. If you have somebody blow out your eardrum by trying to stick a tube in it when you already have an ear infection, it's not going to allow it because you already have a hole there, therefore your ears can't pop themselves. The pressure's up inside your head and it delays your recovery time about 3 weeks. Believe me, I've had it happen. And the only way to solve that is they actually take a cigarette butt and they put it inside your ear and they let the cigarette butt actually heal your eardrum. You don't have to believe me, but that's exactly what they do. So to avoid anything to those extreme measures, there are certain steps you can take when you have an ear infection that will cure it in much less time. First off, let's start with how you really get an ear infection. Ear infections, I didn't figure this out till I was 30. The most common problem is you get an ear infection most of the time through a head cold. And what happens is when you get a head cold, it goes in through your nose, and you'll notice that your nose becomes stuffy and irritated, and you're sneezing, and you're blowing out all the time. That usually takes a couple of days for the virus or bacteria infection to work your way through your nose, and the next stop is through your ears. And this is where the problem occurs because it doesn't start off bad. Therefore, you may be taking things you shouldn't in the meantime, but as it progresses, what happens is you get the infection. The infection will cause a condition called glue ear. Once you have glue ear, you are in for it for quite some time. Glue ear happens when the mucus gets so thick it cannot flow through the eustachian tubes, which you have one on each side, and the pressure will change every 20 minutes. If the mucus gets so thick it cannot go through this eustachian tube, think of it as a highway, whereas if you have an accident and all the routes get blocked, then you will have pressure that you've never imagined before. Picture going up in a plane when you have the popping of your ears when you go up 20,000 feet in a plane, but you can't pop it. Okay, and that is pretty much what you get with glue ear, and it could last for hours, if not days. I have been to the ER in several different hospitals because of this diagnosis. And this happens when the ear infection gets to a point where medicine can't help and your body just has to heal itself at that point. They try many things for ear infections. Doctors will recommend steroids. I've had steroids injected into me, such as Decadron, and they're fast acting. But the problem is, if it's so thick, you just have to wait for your body to heal itself. But like I said, there are a couple different routes you can go to actually avoid glue ear from happening, and I will I'll show them to you right now. The first thing you're going to want when you ever have a head cold, if you're afraid of any type of ear infection from happening, Everybody believes you lead with steroids. That's a common misnomer, especially from doctors. And if you always go to doctors, oh, they'll give you a Z-Pak or they'll give you some type of steroid to try to counteract it. It's just another example of the doctors wanting to push drugs first. I am not a big believer in that, and I know from experience. What I happen to always now think, since this has worked for me for the past 5 years, you never lead with steroids, you follow with them. And what I mean by that is you always want to lead, which is one thing they never tell you right off the bat, you have to learn from trial and error, is with, and you've all heard of it, amoxicillin or Augmentin. Okay, it's an antibiotic. You always lead with antibiotics. Whenever I get a head cold first, the first thing I will take is an antibiotic. Because what happens is, if you get sick and then you get infected, it takes the antibiotics much longer to work. If you get sick and you're already leading with the antibiotic, you already have it in your system. As we all know, Augmentin or amoxicillin, both really the same thing. What they basically do is they take 24 to 48 hours to work through your system. So if that's already in your system, you can't get infected. And that is the big key. You can't get an ear infection if there's nothing to infect. The Augmentin and amoxicillin prevents that from happening. Okay? And that is the one thing you always want to lead with. And there's, of course, a couple ways how to get amoxicillin. Your most common way is to go to your doctor and recommend it. If he doesn't give it to you, a dirty little secret is you can always go on Google and to the Canadian pharmacies and order it from Canada. It's about $2 a pill, but if you need it, you need it. And especially if you had a lot of history and problems with ear infections in the past, you're going to need it. Okay, so this is the most important thing you could possibly do, is always lead with an antibiotic. Most people ask me how long. I'd say keep taking the antibiotic for 7 to 10 days, because that's usually how long most head colds will last, and you do not want to get it infected anytime during the head cold. Okay, because that's how long it takes to get through your system. What you do need, I always like to take this as a preventative, which is an allergy pill. It really doesn't matter. I like taking Zyzil personally, but you can take any of the ones that are out there, Claritin, any of the allergy medications that are either over the counter or behind the counter. It really doesn't matter, because it may be your allergies that contribute to the mucus thickening up. So you want to actually take care of that root as well. It's not going to hurt you. The third thing, if you do want to take a steroid, and there are a lot of people who do believe in steroids for inner ear infections, it's inner or middle ear infections actually, the best thing to take, which a doctor may recommend to you in tablet form, is prednisone. Prednisone works for a variety of different things. It's an anti-inflammatory pill, and it's great for thinning out the mucus and drying you up. So prednisone, you usually don't want to take more than 2 or 3 a day, especially if it's 10 milligrams. Again, that's double if you're taking 5 milligram tablets. Excuse me. And finally, if you don't want to go the steroid route, if you'd rather go something that you have to sign for over the counter, but you don't need a prescription for, people often forget about this, and it is one of the most important things you have to take when you have a head cold to prevent an ear infection. It is the Sudafed 24-hour. Please do not get anything that is not Sudafed. You need pseudoephedrine. Pseudoephedrine, unlike all the ones that are not over the counter, which they have a different type of drug that doesn't have the same effect as Sudafed does. There's a reason why Sudafed is over the counter. Number one, because pharmacists are afraid that you'll create meth out of it. But number two, it's because they don't want you overtaking it. That's why I always get the Sudafed 24-hour. Nothing works like Sudafed for a head cold. It keeps the mucus thin, it allows it to drain, and will keep you from getting glue ear. It is one of the things that you definitely need. I get the 24-hour tablets. If you open it up, there's 10 tablets per box. They look like this. Obviously, you just take one a day. It's the easiest thing you could possibly do. So with that said, those are the 4 things medically wise, that you could do to prevent an ear infection, but most important, leading with the antibiotic. However, if you don't want to go the medication route, which you don't have to, I mostly now do when I get an ear infection, you can always go the natural route as well, either to go to the natural route to try to solve it or to complement it. I do it to complement it because there are two things I'm going to explain to you right now that is all natural that most people do not know about. First of all, the wonder of garlic. Garlic is they call it a miracle herb, if you want to call it that. It does a lot of things for your body. Most people use it to cleanse their body. Whenever I'm doing a cleanse, I will take, like, this is minced garlic chopped in water. You can get this at any food store, and all you have to do is you take a teaspoon, 2 teaspoons full of this with water every morning, first time when you get up in the morning. Wait 20 minutes, then resume your day. What that does is it will go through your body. You need time. The reason I say 20 minutes is you need time for the garlic to run through your body and basically get out everything that's in your system. And that's anything you've eaten, all the parasites and tapeworms you may have in your system from food you may not even know about, such as pork, ham, stuff like that. Anything you eat, sushi or anything like that. This will take care of that problem. But for an ear infection purpose, what it does is this is a natural antibiotic. If you don't believe me, look it up. It is the one thing that it sits at the bottom of your stomach and acts as an antibiotic. If you take it every day, you will get almost the same effect as you would by taking Augmentin or amoxicillin. I like doing them both because they can't hurt. Having 2 antibiotics down there that do totally different things, one natural and one man-made, is not going to hurt you. But this cleans you out as well. And it does shorten the time of a head cold. So garlic is always essential if you're going to go the natural route or to supplement the prescription drugs that I have mentioned before. Okay, and the other thing, because what happens in a head cold is not only do you get congested, but you get backed up, and you need something to clear out your system. And believe it or not, a lot of people like taking probiotics, but the all-natural probiotic is right here, and believe it or not, it's sauerkraut. They did a study, and 2 forkfuls of sauerkraut is the same as 100 tablets or capsules of probiotic pills. It's absolutely amazing what basically sauerkraut can do because of the fermentation process. It gives you such thousands and millions and billions of good bacteria because of that fermentation process that will always help. And they recommend, again, if you're going to do the garlic in the morning, they recommend you doing the 2 teaspoons of garlic, waiting 20 minutes, take the sauerkraut, waiting another 20 minutes, and then eat anything you want. It's a great thing to combo these two because you get your probiotics and you get your cleansing all in one, and you get your antibiotic as well. The many other benefits of garlic, you can go look that up as well. So again, those are 2 different ways to go about it. I like to take all of them and put them all together so you have the best of both worlds. And ever since I've been doing this, ever since I was 30 years old, I'm turning 35 next month, I have not been to the ER since, and I don't hope or happen to want to go back there again. It is not only expensive, but there's not much they can do for you except shoot you up with more steroids, which will only give you temporary relief, if that. It's better to be safe than sorry, and it's better to be smart than stupid. So please learn from my mistakes, and that is my advice on how to prevent an ear infection. Everybody, have a great night.